HealthPathways is an online portal that contains evidence-based information that's designed to be used by the GPs at the point of care. I'm a staff specialist out at Liverpool Hospital, and as my role as the District Clinical Lead for the HealthPathways project, my role is to liaise between the hospitals and the GPs, which form part of the primary health network.
I think it's been a long time coming. The Health Pathway is a very important program to get some efficiency in the health system. Okay, as a practicing GP, one of the difficulties we have is that there's a lot of maze that we have to go through in our interaction health service. Trying to refer a patient, for example, to a particular clinic, there are different forms you need to fill in, different departments got to ring, some takes online booking, some has to be phone, some has to be fax. And they keep changing all the time, different departments, so there's a lot of roadblocks along the way for us to do our job. That's from our end. When you think of it from the patient's point of view, it's even worse. At least I know the health system, I know how to somehow navigate that. So from the patient's point of view, some of them just give up, just too hard. So for the first time, for a long time since I've been a practicing GP, that's now a genuine effort from both sides of the fence, the health service and primary care, to try to streamline that. I think the benefits are going to be enormous.
It's a portal designed to be used by the GP at the point of care. So what it does is it takes a lot of different pieces of information and puts it together in one spot, and it's specific for our district.
And at the end of the day, it will mean that patient can have a seamless journey across the medical system, and GP will be a lot easier for them to do the job, and therefore we can concentrate on what we do best, which is actually look after patients. From the health service point of view, it means they can see those patients that genuinely need the services. And a lot of those patients that may be waiting for a long time may not necessarily be waiting. And so it also has an opportunity for us to come up with systems whereby we'll be able to identify that there are gaps in the services. And the health service doesn't know that. So for the first time, we'll be able to identify, and perhaps there will be some service redesign to put in resources in areas that are definitely needed now. So the system will allow me to be up to date in terms of the processes itself, forms that need to be done, but in terms of treatment, okay, the best evidence-based practice, best evidence-based drug that I should be using. So for me, that would be a lot easier. And most important bit, it will really cut down a lot of my time wasting chasing after paperwork. Now that not necessarily involve me alone, that my practice nurse and my staff.
So creation of the pathways is quite a dynamic process. For each pathway we have a method of prioritisation. It's basically based on priorities for the GPs and also for the district. And where those priorities match, we start developing the pathways. The pathways are then developed in conjunction with the GPs, as well as the specialists and any other key stakeholders.
The amount of money available for the health system in this area is not going to be hugely increased anytime soon. But if we can make significant improvement in efficiency, it will benefit the workflow of the clinicians. From the patient's point of view, it will be a very smooth journey for them. And the health service benefits will be they get to do what they're meant to be doing, serving a community.